Hi, I'm Robert Byrne from the Deutsches Herzzentrum in Munich, and we're here at ESC 2011 in Paris, France, and it's a great privilege to be joined by Professor Kimura from Kyoto in Japan, and he has just presented a hotline session on the randomized trial RESET, which was looking at everolimus-eluting stents against sirolimus-eluting stents. So welcome, and thank you for being here with us today.
It's my great pleasure.
Yeah. Maybe you could give us a little bit of a background to the trial and tell us a little bit about the trial design. I know that this is actually the largest randomized control trial that we have comparing EES with SES.
Yeah. Actually, this is a prospective randomized multi-center open-label trial evaluating non-inferiority of the new everolimus-eluting stent compared to the old sirolimus-eluting stent. February last year, everolimus-eluting stent was approved in Japan. So simultaneous with the launch of the everolimus-eluting stent, we started the comparison of everolimus with the standard drug-eluting stent at that time.
Okay, and this was a trial that you powered predominantly for clinical endpoints or for angiographic endpoints?
Predominantly clinical endpoints, so we have enough statistical power for evaluating non-inferiority with for the target lesion revascularization, which is the primary endpoint of the study.
Okay, and how many patients did you enroll altogether?
Yeah, 3206 patients.
3206, yeah, so a very large trial. Yeah. And what were the main findings in terms of your primary endpoint, your primary hypothesis?
Yeah, actually the 1 year target lesion revascularization rate was 4.3% for everolimus-eluting stent and 5% for sirolimus-eluting stent. So everolimus-eluting stent was demonstrated to be non-inferior to sirolimus-eluting stent, but for the superiority analysis, target lesion revascularization rate was not different at 1 year.
Okay, so in terms of clinical anti-restenotic efficacy, then actually a very good result in both treatment arms.
Yeah, I think so. But if we look at the patient characteristics enrolled in the trial, despite the all-comer trial design, but the actual patients enrolled may be a little bit low-risk patients.
Yeah. So yeah, I mean, we saw, I think, in a nice discussion from Professor Windecker that he highlighted some of the differences with trials in Japan as compared to trials perhaps in Europe. And one of the features highlighted was that a high proportion of patients with diabetes in the Japanese population. What proportion of patients had diabetes, and is this typical in your experience?
In this trial, 45% of patients were diabetic. It is very, very typical for the Japanese observational studies also. Yeah.
Okay. And so we seem to have comparable results in terms of clinical outcomes looking at anti-restenotic efficacy. I know that you also had a subset of patients who received angiographic follow-up. How many patients received angiographic follow-up, and what did you learn from that subset?
Actually, the 571 patients were enrolled in the angiographic sub-study. Surprisingly, 90% of patients came back for repeat angiography at 8 to 12 months.
So very high rate of angiographic surveillance. That's excellent.
Yeah, actually, angiographic measure seemed to be consistent with the clinical outcome. Restenosis rate was 5% for everolimus-eluting stent, 4% for sirolimus-eluting stent. Rate in segment and rate in stent rate loss was almost identical for both groups.
Okay, so then I suppose you have follow-up out to 12 months at this time point, or you have follow-up to a longer period?
Actually, the trial was designed to follow up patients up to 3 years.
Okay.
So we are very interested in finding how the everolimus-eluting stent could reduce the late adverse events reported for sirolimus-eluting stent, very late stent thrombosis or late catch-up phenomenon.
Yeah, and what data do you have on stent thrombosis out to this time point? How does it look between the two stents in your study?
There was no difference in the rate of stent thrombosis, almost 0.4% for both definite and definite or probable stent thrombosis in both groups. Okay. A very, very low figure.
Yeah. So we now have a number of randomized clinical trials, your trial being the largest, also a study from the sort-out investigators, and also a study from ourselves in the ICER Test 4. And it seems that it's very comparable efficacy actually between the Science stent and the Cypher stent. Some people then might find it questionable that the Cypher stent is now no longer available on the market, despite a relatively good performance in comparison with Science. Do you have any insights into this?
Yeah, actually, the one of the limitation of our study is we don't have clinical implication in terms of the selection of a stent type in the real clinical practice because of the Cypher stent is no longer available. But the sirolimus is a very good drug and a very important drug. So in future, some other companies might use sirolimus as a drug for the new drug-eluting stent.
Yeah, I think so. Well, thank you very much for coming in to talk to us today, and congratulations on an excellent trial.
Thank you very much.
Thank you.
Thank you.